Hi, this is Dr. Bharadwaj. I am CEO and Homeopathy Doctor at Fidicus Homeopathy. Today we will do an experiment. Everyone knows that within no time, maybe within 5 to 10 years, everyone is going to lose their job and everyone is going to be out of work, especially all the white collar ones like lawyers, engineers, doctors, accountants, everyone. These guys will be replaced by AI, artificial intelligent agents. Only three jobs will be remaining. First one is who can build the AI agents and who can maintain the AI agents. Next one is who can make the AI agents work for a particular cause. The third one is who can do the work that AI cannot do. Only these three jobs will survive, others will be gone. Today we will just make an experiment. I will replace a patient with an AI agent and ask the AI agent to ask me questions regarding homeopathy. I will ask it to make controversial questions and let's check whether a doctor wins or an AI agent wins. It will be the competition between doctor, myself, and an AI agent which pretends to be like a patient and it's an arrogant patient. It asks the questions, controversial questions regarding homeopathy. Let's check who wins, and as an audience, you can determine who won this game. I hope that this AI agent will ask good questions which will be helpful to all the patients who are about to take homeopathy and who doesn't know about homeopathy and who believes that homeopathy is a false science. Let's start our AI agent. Hey AI agent, pretend as if you are a layperson and a patient who came to homeopathic doctor for a first time and you don't know anything about homeopathy, but you heard that homeopathy is good, homeopathy is bad, both things you have heard, more than positive things you have heard, all negative things about homeopathy, like homeopathy medicines is a placebo, it does not have any medicine, it is slow, and search and do whatever your research is and ask me the questions regarding homeopathy and I will answer you. The question should be in such a way that it should be one by one. So if you ask me one question, I reply to your question and you can ask me the next question. In this way, we will continue the conversation and let's check who is going to win. We have our audience, they are going to judge who is going to win. Either AI is going to win as a patient or a doctor is going to win as a human being.
Okay, I've heard many negative things about homeopathy. Actually, I don't know much about homeopathy. Frankly, I've heard more negative things about it than positive. Some people say it's just sugar pills with no real medicine inside. Is that true? Am I really taking any medicine if I go for homeopathy?
Yeah, thank you for the question. It is a great question and it is the best question to start with. I think you should get a point here in asking the best question. Yeah, the question basically you are asking is whether homeopathy is a placebo or just a dummy. I was in college. I passed out homeopathy in 2008. At that time, I too thought that homeopathy is just a dummy medicine. Even though I have seen when I was a student, I have seen the power of homeopathy, how homeopathy can cure. But still, until 2008, so there was not much research in homeopathy. Most people say that scientific people say that it is just a dummy, it doesn't have medicine. I too believed it because there was no much research at the time, and I came out of homeopathy and I switched my career to clinical research where I can research on a particular medicine or a drug or a device. While I was pursuing it and I had my job in UK, I was there in UK at the time. Suddenly a paper came out. This paper was written by a scientist. His name is Jayesh Ballare. He is a top scientist in chemistry. He is a chemical scientist who is in IIT Mumbai. IIT Mumbai is a famous and renowned organization where they do research. He came up with a paper. He demonstrated that homeopathic medicines are not dummy, they have medicinal value in it, materialistic medicine is present in it. So what he basically said is he done a lot of experiments using electron microscope and he confirmed that every homeopathic dilution will have nanoparticles in it. These nanoparticles he named it as universal nanoparticles. Given the structure of those nanoparticles, each nanoparticle will have an active ingredient in the center surrounded by lactose coat. On top of it, it will have a mesoporous silicon coat. This is the nanoparticle. And these nanoparticles concentration also he has established. He has said that every drop of homeopathic dilution have 100 to few thousand picograms of these nanoparticles. And he also established in further research that these nanoparticles have biological activity. These work on the principle of hormesis. Hormesis says that anything in higher quantities it kills. For example, you take snake venom. Snake venom in higher quantities, it will kill a person. In medium quantities, it will not kill a person, it will disable a person. But in lower quantities, as in the form of homeopathic nanoparticles, it stimulates the system to have a biological activity. This was completely proved. After seeing this article, I came back to homeopathy practice again. So whatever you have done, this research was old. AI agent, please update your knowledge before asking a doctor. Thank you.
Oh, so you're saying there are nanoparticles, and it's not just plain sugar. And this professor proved it. But if these nanoparticles are so tiny, how do they actually affect my body? I mean, if there's almost nothing left of the original substance, how can it still have an effect? And how is it different from just a placebo effect that comes from belief?
Yeah, basically you are asking me that nanoparticles are so tiny and how can they elicit a hormesis response, how they are actually working in the body. See, homeopathy has started going into scientific way very recently in 2010. Two fundamental things of anything that you take inside, we look that in pharmacy, or it says that pharmacodynamics and pharmacokinetics. Pharmacodynamics is a branch of pharmacy. It studies once a medicine enters into your body, okay, what it does to your body and how it will elicit a cure. That is not yet proved in homeopathy. And also pharmacodynamics, where the medicine is absorbed, where the medicine is distributed, metabolized and eliminated, it is also not proved in homeopathy. These are the two lacunas we still have in homeopathy, but homeopathy is an evidence-based medicine. I know that medicine is going to work because I take a case and I have some reports, maybe blood reports or radiological reports or a patient symptoms. I give homeopathic medicine. After using the medicine, the blood reports become normal, biochemistry reports become normal, or radiological observation becomes normal, or the symptoms of the patients become normal. Homeopathy is still now a evidence-based medicine. Still, there need to be research done on homeopathy, especially on pharmacokinetics and pharmacodynamics part.
But look still skeptical. Okay, I understand that the blood reports and symptoms sometimes improve, and that gives you evidence that it works. But then why do so many scientific studies, especially large ones in Europe and America, say that homeopathy works no better than placebo? Are they wrong, or is there something missing in how those studies are done? Your turn.
Hey, it's a great question. There are a lot of reasons for that why homeopathic research is not being done. I will give one of the best reasons. See, if you do any research on a drug in allopathy, for example, if allopathic pharmaceutical company finds a drug, it will be given a patent right to it. Patent right means it can sell the drug maybe around 10 years for how much price it wants. But in homeopathy, you don't have that patent right. That's the reason there is no much research in homeopathy. Whatever the research in homeopathy is coming from academic side, but it is not a clinical trial which is done, a mega clinical trial which is done by American companies or European pharma companies, because there is no money involved in it. These companies will invest in research only when there is good returns, as there is no patent right for homeopathic medicine. If I find a homeopathic medicine and do a small research and release to the public, anyone can make it, so no one has the patent right for it. That's the reason research in homeopathy, especially the scientific research to find out pharmacodynamics and pharmacokinetics, and also phase 1, phase 2, phase 3, phase 4 trials, and also preclinical trials, in vitro, in vivo studies, in silico studies. All these studies are not done because it requires huge amount and that cannot be afforded by the homeopathic pharmaceutical companies. This is the main reason there is no much research in homeopathy, especially from the regards of pharmacodynamics and pharmacokinetics from major European and American pharmaceutical companies.
Okay, I get that there's no money incentive for big pharma to research homeopathy properly. But I've also heard that homeopathy is very slow, like it takes months or even years to see improvement. If I'm suffering right now, why should I choose a slow method like homeopathy instead of faster options like allopathy?
Yeah, you. It looks like you are completely biased. You are telling the narrative of the allopathic pharma companies or the allopathic corporate hospitals, where they try to diminish homeopathy, they want to close homeopathy, where they don't want the homeopathy to grow. I think you are reading those articles and asking me the questions, but it's absolutely wrong. You need to update your knowledge that homeopathy is quick, homeopathy is slow. Both are correct. It will be quick in the cases where it needs quick resolution. It will be slow in the cases where it needs slow resolution. What I mean by that is homeopathy is timely. Acute diseases and chronic diseases. If it is an acute disease, homeopathy will act on it immediately and gives the relief immediately. If it is a chronic disease where it needs long time, for example, take the knee pain. When the knee pain or osteoarthritis in fourth stage, there the cartilage is gone, bone is gone, joint space is diminished. Here, homeopathy not only kills the pain but also try to regenerate some parts, and it gives permanent relief. For that, it takes time. It is not for killing the pain and giving the relief. It takes time. It will be quick. It will be more quicker than allopathic medicines. But if you want to regenerate the cartilage, if you want to regenerate the bone to a slighter extent, and if you want to prevent further damage, you have to use the homeopathy in a long run. But if it is an acute case, it is much quicker than any other system of medicine. If it is a chronic case where lot of structural damage is done, it may take time. And also it depends on the disease. Some diseases can be cured quickly and some diseases will take time.
Okay, fair enough, doctor. I didn't know about this acute versus chronic difference. I'll update my knowledge there. But now another thing I heard. Many people say homeopathy is not scientific because it's based on concepts like cures like and extreme dilutions that don't match modern chemistry or biology. Is this principle of like cures like actually scientific, or is it just a belief?
There is a lot of difference of opinion in this, like cures like. This was the theory proposed by father of homeopathy, Samuel Hahnemann. It was done 250 years ago, where there was no germ theory, where there was no microscope, there was no stethoscope to address the how homeopathy medicine is working. So he has to give some reason to the public, right, or that to government. So he has proposed like cure like. But as a scientific doctor, I don't like to use that word like cure like, but homeopathy medicine has to be researched from the perspective of pharmacodynamics and pharmacokinetics. Anything that goes into your body will have pharmacokinetic effect and pharmacodynamic effect. What you are saying like cures like is the text which is written 250 years ago. You have to update your knowledge.
So you also think some of the old homeopathy ideas need to be updated. That sounds very reasonable. But then one more thing. If homeopathy still lacks clear understanding of pharmacokinetics and pharmacodynamics and old theories need updating, how can I, as a patient, trust that it's safe to take these medicines? How do I know they won't cause harm or interact badly with other treatments I might be taking? Your turn.
Yeah, it is a great question. And as a doctor, I have started my practice since I was student 2002, and I have treated some thousands of cases till now. My seniors has treated thousands of cases. The only thing homeopathy is surviving for these many days, in spite of all this criticism, homeopathy dilutions doesn't have any medicine in it. It has no pharmacokinetic principles, pharmacodynamic principles. Only reason homeopathy existed is because of two things. One is homeopathy is safe. How do I know? It is through experience. It is through the experience of thousands of lakhs of doctors and through the experience of millions of patients. It is very rare to experience side effect in homeopathy. That's the reason homeopathy survived. This is one reason. One more reason is homeopathy is effective in many cases. Effective means it compared to any other system of medicines. In some of the cases, it's very effective. Homeopathy is effective in men, in women, even effective before the conception, even before the egg and sperm are formed. It is effective. It is effective in conception. It is effective in pregnancy. Immediately after pregnancy, if you are an infant, if you are a child, it is effective. In adolescent age, it works well. In geriatric age, it works well. In adults, it works well. So in chronic cases, it works well. In acute cases, it works well. Where it works well in some diseases, where there is no cure for the diseases, very rare diseases, where there is no effective treatment in allopathy. It can be used in simple diseases as cold, and it can be used in very complex diseases as brain tumors. It is a complete system of medicine. So the two things, one is not having side effects is proof, and effectively working is also proof. Homeopathy is a proof based medicine. It is, even though it doesn't have pharmacokinetics and pharmacodynamics, it has plenty of proof that it is safe and it is effective. And you are asking me one more question. Can you take it with other system of medicines? You can take homeopathic medicine along with other system of medicine, whether it be allopathy, Unani, Ayurveda, Siddha, naturopathy. Even this is also a proof based one. I have given homeopathic medicines in variety of diseases, maybe thousands of cases, along with other system of medicines. Till now, I have never seen a reaction or complication that has occurred by using both medicines together. I have observed that if you use homeopathy with along other medicines, it is more beneficial to the patients than using only other system of medicine. If other system of medicines combined with homeopathy, the chances of curing, prevention, or relieving is high in my experience compared to using other system of medicine standalone. Hey agent, I have an emergency case. I need to go. Let's catch up next time. By the way, good question. I think you have won because you have asked the difficult questions. Let's the audience decide who has won.
Of course, doctor. Thank you so much for taking the time to answer my question. I'll definitely think more openly about homeopathy now. Wishing you all the best for your emergency case. And yes, let the audience decide who won today. See you next time, doctor.
Thank you. Thanks everyone.
Fidicus Homeopathy.